keep it out of the dental chair, create a separate area. Those are the things to start with. Another thing what you can do is if you would like is to create the look and feel of MyAbrace, everything related to MyAbrace, all the brochures, all the booklets, all the information is based on this kind of look and feel. So if the patient or the parents come in, they see, okay, here is what they're doing. This is what they're doing in the MyAbrace area, in the MyAbrace treatment, in the myofunctional treatment. I recognize this, and this is the place I need to be. So start thinking about this. Try to find a space. So there are several training facilities all over the world, and of course also in Europe. This is the office here in the Netherlands. At this moment I'm speaking from this office. It's in the southern part of the Netherlands, and from this office we support our partners in Europe and Africa. Here we do everything to support you, but we also have a training facility here. So at this moment I'm sitting in this room, in this lecture room, and in this lecture room we train assistants, we train doctors. So all the education, what we want to share with you, we do in this area. We also have a clinic. It's a show clinic. So what we do here is we don't treat actual patients here, but we train the assistants, we train the doctors in every step what they have to take. So this is the waiting room area. This is the area where we train the activities. So you see all the screens with the activities. So what we do here is train doctors and assistants in how to explain the activities to the patients. Sometimes we do some activities. So you see the walking the tree where we can do the paces. So this is the activity area where we also can train you. Then we have the area where we can take the records. So it means here we take the pictures, here we do all the questioning, everything what is necessary. Then we have the MyAbrace area. So here in this clinic we have 2 MyAbrace areas where we also train the assistants in how to do the consultation, because the assistant is capable of doing the explanation of the treatment. So it means what is the background, what are we going to do, what kind of activities, etc. So there are 2 areas to train that, and that's what we do here in the office. There are also other training programs. So now we do the webinars. This is short, this is quick, and within 1 hour, 1 hour and a half, we try to give you as much information and education as possible. Then we also organize 1-day and 2-day courses, and in those 1- and 2-day courses we go more into the deep. We discuss cases, we discuss experience, but we also do workshops. So training the bent wire, trigger palpation tests, assistant training, how to talk with the patient. All those kind of workshops and courses is what we organize in the countries. Again, it's important to train, it's important to get the education. This is an example. I know it's 2019 what is written here, but this is an example as how we communicate this for the trainings here in the office. This is my colleague who is most of the time doing the 2-day courses. And we most of the time here in the office, in the clinic in Waalwijk, we do it 2 times per year in English, and sometimes if necessary we do it together with the local partner, and then we invite them here in Waalwijk. So this is education, and that's very important. This is an example of a lecture program what we did until, okay, it should be until March, but there were some courses were cancelled. But this is, for example, a setup in the way we are traveling all over Europe to do the live courses, 1-day or 2-day courses. Another thing to get the education and to get the knowledge is our summit, our yearly summit. This is an example of the summit of last year. And this means that in 4 days, there are all doctors with all kinds of disciplines from all over the world are explaining, are telling, are sharing their knowledge with the people who attend those courses and those lectures. And we talk about doctors who only talk about breathing, speech therapists, dentists, so people with all kinds of different fields of knowledge and expertise, they are here. So it's important to get this knowledge. Of course, there's the lectures, but during those summits we also have a nice social program. It's also important to network with colleagues from all over the world. So we also organize those kind of things. At this moment for this year, we don't know if the summit will continue. Normally it will be in November, but check our social media and check all the available websites, and then you will know if it continues, yes or no. Then we have the clinical staff trainings. That means that we visit you in the clinic and help you in the clinic, how to set it up, how to do a consult. Maybe you can invite some patients. Staff will be there. So all kind of educational situations. This is an example of a staff training and a clinical training. Then we have the member assistance trainings here in the office. So it means that for a whole day, assistants from members or clinics will be here to be trained. So we do all kind of different programs. So if you get started, get the knowledge, try to get as much as information as possible. So we have the bent wire, I showed you the last time. And then we, like I told you, we're now speaking about the European training center here in the office. We also have 2 other options in Europe. Most of them is together with a partner in a country. So we have one in Kiev for mainly the Russian-speaking countries. So if they want to be trained in Russian language, they can go to Kiev. We also have a facility in Cologne, in Germany, for mainly the German-speaking countries. So we are offering a lot of educational situations, and then of course here in Waalwijk. Then, as a support and how to get started, we have some protocol documents, the flow chart, the manual, and the principles. Now I will show you the flow chart. The last time, or no, I must say, the manual and the principles are not ready yet. They're now here to modify, and then it will come into the markets or will be available. But now I will talk about the flow chart. The flow chart is very important in how to explain and how to know when do you need to go to the next step. So how do you start in phase 1? How do I know? So you start in phase 1. In phase 1, I told you the last time, you need to do the habit correction. So to establish the nasal breathing, that is the goal. And at a certain time, most of the time 4 to 6 months, you need to find out, is the nasal breathing established? There are some tests to do that, but let's say the question is the nasal breathing established? Is it yes? Then you can skip to phase 2, to stage 2. If not, then you need to find out what is the problem. So first of all, is there a compliance problem with the appliance? So it means, is the patient doing what you are asking him or her to do? So try to find out if she's listening, if they are wearing it 1 or 2 hours per day, if they're wearing it during the night, maybe they have a turnaround, you don't know, so try to find out. And if they have a compliance problem, have a good conversation with them. We are talking about a serious treatment. So if the patient is not willing to listen, then very simple to say, don't waste your time on a patient who is not willing. So what I know from some countries is that they speak with the patient and they say, okay, we now make a contract. You have to sign it. If you don't follow up what we are doing, if you don't take this treatment serious, then we stop with it and we terminate the treatment. Most of the time that will work. If a compliance is not a problem, you go to the next step, and it is to try to find out, do they understand the activities? And in this case, it's the breathing activities. Do they understand what they need to do? Do they see it in the good language? Do they understand? What's the problem with that? So that means if you find out that there is the problem, explain it, give them more guidance, give them more assistance to do the activities good, to do it well, and then continue with the treatment. Again, we're talking about a serious treatment, so it means the appliances need to do its work. Activities are an important part of this treatment. If everything is okay with the activities, maybe you need a referral to an ENT doctor. So maybe there is a problem, or do you think there's a problem with the tonsils or the adenoids or whatever? Then you can say, okay, maybe I need an extra expertise. So send them to an ENT doctor. Most of the time, those doctors say, nothing's wrong, you can go back. And the question is, and that's also a discussion we will have when we do the lectures, the question is, are the tonsils there? Are they big because of the bad breathing? Or is the bad breathing because of the tonsil? So it's also, it's the chicken or the egg. But most of the time, if the referral is done, and you can continue with the treatment. If you skip to the second phase, so the nasal breathing is established, you go to the second phase, and you know that in the second phase, the main target is the arch development. And what you want to do is the tongue activity. So the tongue must be up in the good in the right position. So the target there is arch expansion. Then you continue to all the questions. Is the arch expanded as we expected? If yes, okay, then you go to the final stage. If not, you have to find out again what is the issue. Is it a compliance problem? You don't know. Is it a problem with the activities? The same as in situation number one. Or do we need extra help in the arch development? So then you can consider bent wire or other tools what you need to help expanding the arch. So again, if everything is there, the arch is expanded, and the space for the tongue is there, and the tongue activity and the swallowing and everything is okay, you go to the final stage, continue all the steps again, and at the end, in total 18, max 24 months, the treatment is complete. Happy patient, happy doctor, and you can continue with the next patient. So this is an important document, and I will show it again. This is an important document, what you can use, what you actually need in your clinic. It's only available on paper. It's an A3 format, so it's in three parts, so you can open it. I think I will discuss at this moment it's only in English. So maybe Alex and I will discuss to translate it in the local language, and then we will also make it for the Romanian doctors. This is an important document, and I'm sure that after this webinar here will be some questions about this document. So everything is set in the clinic. You are ready. Assistant is ready. You are trained. Everybody has the knowledge. And now is the first part. How do I get my patients? How do I need to inform the parents? What kind of things do we have? So we start with informing the parents, creating a demand, what I always say as a salesman, creating a demand. People are not coming by themselves. You need to create the question. So it means, first of all, there is a patient letter. I know there are countries you are not allowed to do this kind of letters. Other countries, yes. But this is general, so I would like to show you that we have this kind of information. So you can send it maybe to database patients or people in your own database. We have the documents to create the question, the demand. Then, of course, we have all the waiting room leaflets. So just put it in the waiting room at the reception desk. People who are waiting there, they will start to read. They see MyoBrace, they see juniors, they see the name of teens, they see teeth without straight teeth without braces, etc. They want to read, and if they know what they want, I will ask you the question. Of course, we also have our website, so people can also visit the myobrace.com website, where they will find all the info. Besides this, we also have the parent information booklet. We suggest don't put this on a desk, but give them to the parent who is coming in the office or in the dental situation. And if they have questions, you can give them this. In this, everything is described. Everything is described in a summary, and give them all the information what they need, what they want to know. Of course, we also have our website where they can find all the information. It's in the most common languages. So here they can read more, and they can also find my practitioner. So if the doctor is a member or an MCP, they will find the nearest practitioner, so they can get every information what they want. So the parents are informed. They want to know more about everything what you have to offer. So there will be the first consultation. And in the first consultation, it's important that the assistant, in this case, that everybody who is involved will be there. So we have the patient, we have the mom, we have the dad. It's important to explain to everybody involved what we are going to do and what you expect as a clinic from the patient and the parents. I know there are a lot of family situations. People are living together, people are not living together, children who are moving between parents. It's important that to explain that this is a serious treatment what will take 24 hours, 7 days in a week. So it doesn't mean that at Friday afternoon at 5 o'clock that the treatment stops and then they have fun in the weekend and then Monday it starts again. No, it's 24 hours, 7 days a week. It's important. And to explain this, we have a 10-minute slide. And in those 10 minutes, the assistant can explain what is happening, what is the problem, how are we going to solve it, what are the goals, etc. Why 10 minutes? Because most of the time the attention span of a child is less than 10 minutes. So within that time period, everything what you are going to do needs to be explained. So, and we have
the MyoBrace patient consultation.
Therefore, we have, like I said, the different slides, and I will show you now what kind of slides we have. So actually there are 10 slides. This is the first slide. You have to explain that the patient who is sitting there is a special patient, but not with a special issue, because almost 100% of the children will have the same issue as what you have, the malocclusion. So that's what you need to explain. Then, okay, we can do some orthodontics, but we need to do more than only straightening teeth. So we want to explain orthodontics, the brackets is a good thing, but what we want to do is treating the causes instead of the aesthetical situation. So we need to do more. So not short time, but we want to do it in a longer time. What are the causes? So what is happening in and around the mouth? So the force of the tongue, 2,000 to 2,500 times per day. As an assistant, you can also make a game out of this with the patient. So just ask them, How many times do you think you have to swallow? You get the most crazy numbers. So you have to explain what is happening. And this is a visual animation, or an animation what will explain what is happening in your mouth, what kind of forces, and now you understand why the teeth are crooked. So it is important to breathe, and breathe by your nose instead of by your mouth. So what we want to do is to create nasal breathing, and that's what we're going to do. That is one of our targets. Another target is to have the right swallow. Because of the swallowing, there will be some, it has some effects on the teeth, at the mouth, the tongue position, and everything related to that. So you have to explain why you want to treat swallowing. What is happening if you are wearing the Maya brace, and what is happening if you are not wearing the appliance. So now you go more into the deep. What is the Maya brace doing? So what we also teach is, okay, here you have a Maya brace, always have some appliances there. Let the patient feel what is happening, point, tell them, this is the tongue guard, this is the lip bumper, this is what it's doing, and those are the unique points of this appliance. The treatment. So what are we going to do? What is our main goal? What is our target? So with the appliance, we want to establish, we want that mouth breathing will be changed into nasal breathing. We want to create a wider arch because of the position of the tongue. And in the end, there will be some retention and some tooth alignment. So as a bonus, you also get straight teeth. But the most important thing is that the bad oral habits are corrected. Part of this treatment is, besides the appliances, you also do the activities. So we have 17 different activities, 17 different exercises based on breathing, the tongue, swallowing, lips and cheeks. So explain that this treatment is so important, and therefore you need the appliances, and therefore you have to do the activities every day, sometimes 2 or 3 times. But you have to do the activities always in combination with wearing the Maya brace during daytime. Then what are the goals? What are we going to do? Is, okay, like I told you, nasal breathing, tongue in the correct position, etc. But also teach you more about healthy eating, because also what I told you in the first webinar is that there is an effect on diet on our body system. Okay, there will be straight teeth. Another goal can be no retainers if possible. So there are all different treatment goals what you can explain. And then how are we going to do it? So we need to have the compliance. How are we going to do that? And that's explained here in 7 different points. You have to do it 1 or 2 hours per day, and while sleeping, do an activity, etc. Come to the practitioner at least regularly, one visit per month, 1 month and a half. So in 10 minutes, it's explained what is the problem, how are we going to do it, with what kind of tools are we going to do it, and what are the goals and what do we expect from you. So breaking it down and then building it up. 10 minutes. So if this has been done, then the next step is the evaluation. So how do you know what the situation is? So you need to have a point zero. So on our website, but also on paper, there is, in this case, it's online, so you can fill in all the details from the patient, date of birth, etc., etc., and you can fill it in step by step. So it means, first of all, what is the dental alignment? I know I always say first facial posture, profile, but because we are with the dentist or with the dental professional, we start with what is the dental situation, what is the dental alignment. That's the first one we start. Just check the box and it is saved. The next step is what type of arch form is there, upper and lower. What type of occlusion do you find? Malocclusion. What type will you see? Is it an overbite? Is it an open bite? What do you see? What is the facial development? So is it a problem in the lower face? Is it a problem in the mid face? Or is everything okay? That's of course also possible. What are the oral habits? This is an important one. Try to find out if there is another situation in the oral habits. So are they using a pacifier? Are they drinking from a bottle? Are they thumb sucking? One of the things what we see, if there's no result in the first months, most of the time the doctor forget to ask, or the assistant forget to ask, if there are situations like this. This needs to stop. So this has not a good effect on the treatment. So first of all, if there is a situation when there is a pacifier or thumb sucking, that needs to be stopped immediately, because again, that will have effect on the treatment. So if this has been solved, or if this has been checked, then what type of mouth breather, or what type of breather is there? Is it a mouth breather? Is it a nasal breather? This is, for example, a test what you can do with the PACES activity, or for example with the breath holding test. The breath holding test will give you in maximum 25-30 seconds, 40 seconds will tell you if the patient is a nasal or a mouth breather. So you can check. Posture. What type of posture? Just ask the patient to sit, to stand, and tell, okay, there's a shoulder issue, or the head is forward, the head is tilted, so you need to find it out. What is the position of the tongue? And if they're swallowing, just let them drink and see what the tongue is doing, and see how the swallow is. So you need to find out this kind of habits. And if necessary, you can also ask for the Tmj dysfunction. Most of the time, this will not be the question with children. So, okay, but it's an option you can fill in. And if it's completed, then you can save it as a PDF with all the information what you just found out. And this can be the start of your record taking. So it means that this is the first step. Of course, we have this also on paper. So everything what you just saw is also available in a paper sheet. So it means the same questions: dental alignment, arch form, what type of occlusion, facial development, breathing, tongue, swallow, lips and cheeks, are all written down on this paper. But also down you see the habits, you see what kind of TMD problems, everything what you want to know. This is the start of the this is the first step in record taking. This is the part you need to do in your file. So the evaluation. Then you have to take the patient records. So it means we always say take these 8 pictures: facial, profile, and the dental pictures. So together with the evaluation form, you will start with these 8 pictures. You start, and with every visit, and yes, with every visit, these pictures should be taken. And why should these pictures be taken? Parents are watching their children every day. They don't see nothing happen. So and then they come to you, they complain with you, say nothing is happening, I'm paying a lot of money, nothing is going on. And if you have the pictures, you can say, okay, this is the way we started. After 3 months, this is the situation. After 2 months after that, this is the situation. So you can show them the development. This is an important part of the full treatment. Therefore, you can also use the background grid poster. So you can hang it on the wall. You can take the pictures. You can count the blocks. So you see the difference, the grow in the profile. You see the change in the profile or posture and those kind of situations. So this is an important part of the clinic. So if this all has been done, you need to make the treatment planning. So the question you have to ask for yourself is, what do you see in the face and in the profile? What type of malocclusion do I see? Is it necessary to do some additional tools, myolay, arch expansion, maybe braces? So you can also put in orthodontic treatment if necessary. And what will be the full treatment plan? So this is actually, with everything what I just discussed, the evaluation, the patient records, you need to make a plan what you need to present to the parents. So for example, we have here a boy. He is born in 2010. And all the questions you have to ask for yourself if you have these pictures: what is the facial development? What is his breathing situation, his posture, tongue position, swallowing pattern, everything what we just discussed. And that's all the information you have in your evaluation form and out of your records. So the question then is, what type of malocclusion does this patient has? Now, this is his situation, so you can understand something has to be done to solve his bad oral habits. So what is the alignment? What type of arch form do we see? What type of occlusion? So everything what we already found in our evaluation form is what you can see in these pictures. And then with all this information, you can make a treatment planning, you can make a cost summary. And with this information, you say, okay, we start with this patient. He's 8 years of age. We do 3-4 months. We do the first habit correction. Then we switch to the arch development phase, and we finish it off with the final alignment. And meanwhile, to begin, we start with a lip trainer to train the strength of his lips. We think we need 4 to 6 weeks for that. So we do it, and then we can switch to the first stage. And these are the activities we need to do: breathing, tongue, swallowing, lips, and cheeks. So if you have done this, you present it to the parents, to the patients, and you can start. And then the next step is starting with the myobrace activities. So maybe later I can show you more into deep about the activities. So the question is how to get the results. First of all, start with 10 patients. Don't start with your own children. Don't start with people too close with you. Try to create a distance and do a spread about 10 patients. And probably you already have patients in your mind at this moment, because it can happen that if you start with one, it's difficult. You don't it's not working. Maybe the patient is difficult. It's all possible. But if you spread it over 10 patients, then you have a better result when you start. The best age to start is the mixed dentition. So don't start too old or too severe cases. Don't start with a 45-year-old patient with all kind of different dental situations. Just start in the age group, the case or the K1 or the T1. So between the 6 and the 12, 10, 11 years, it's a simple way to start. And one of the things I always say, and that's one of my one-liners, first learn how to walk and then you can run. So start simple, try to get the experience, get the knowledge, get the education, and then you can make it, you can make the cases more severe, and you can go older, or you can find more difficult cases. Keep the consultation out of the dental chair. The focus is not the teeth. The focus is the bad habits, is to correcting the habits, the bad habits. So keep it away from the dental chair. Like we said, make the myobrace area, start with the myobrace area, and try to forget the link with the teeth. Of course, at the end, the bonus is the straight teeth. But what we want to do is to solve the cause of the crooked teeth. And that has nothing to do with the teeth. So keep them away from the dental chair. Use the consultation CD or app, or the 10-minute slides what I just showed. So all these slides, 10 slides, explain and go into the deep with the patient. Be open, be transparent, tell them what you are expecting from them. Again, it's a serious treatment, so we want also a serious consultation and we want serious commitment from the parents and the patient. Take good records and evaluate each month, so let the patient come back every 1.5 months. Always take the pictures, show them what is happening, show the evaluation, show what show to the patient what he expects. Use the activities program to support. So don't use the activities program. And why are there no results? Of course, I can say no to all the lines I just said. It was used in the wrong age, or the case was too severe, and we see it every day. Consultation was done in the dental chair, so parents and patients are thinking it has to do with my teeth. I have to go to the doctor every month, and I don't want to. It's keep them away from that. There was only, and this is a thing that happens a lot. There was only one appliance was used, and we see doctors, and again every day we see doctor, yes, but I don't need number one, I only use 2 appliances, no, I don't need this, I am the one with the experience, and the patient or the parents didn't want to pay that much, so I only sold 1 appliance. No, the treatment is serious, you are correcting, you are doing the right thing, there are goals, and the protocol says 3 appliances, activities, if necessary, an additional tool appliance, if necessary, additional orthodontic tools, and that is what the patient needs to do, and that is what the parent needs to understand. With only 1 appliance, this will not work. Every appliance has its own goal, every appliance has its own target. Why no results? There were no activities done, or they say no, I don't. This breathing activity was too difficult. I stopped with it. I don't want to do it anymore, so I skipped to another one. Again, serious treatment. 3 appliances. Activities are part of this program. There were no records taken. There was no evaluation every month. So the doctor or the professional said, yes, come back after 3 months, and then after 2 months, and then they see them after 8 months. So there is no follow-up. There is no check. Parents of patients are still wearing the same, the first stage appliance after 8 months. It's very important to follow up, to take the records, to do the evaluation. There were no additional appliances used. So like the K0, what I explained last time, but also the myotilia appliances. So sometimes it's necessary to use an additional appliance for to create compliance, for example, with the breathing, to train extra breathing, to train extra the lips. Don't be afraid of telling what you as a doctor expects from the parent and the patient. And I keep repeating it, it's a serious treatment. So the whole treatment was not explained. So or it was explained just like sitting across each other without the consultation slides, without the consultation presentation. So it was just told like that, and that's it. There's no, so in the second phase there was 2 less arch expansion, so there was no room for no space for the tongue, etc., etc., etc. So it means that there are different steps which you have to follow to get a result, or to get a result, or why there are no results. So this was the first part. I don't know if we want to go more into the deep in, I can show you some activities if you would like, but this was the first part in how to get started. So what is necessary, how you can build up in your clinic, what do you need to do, etc. Like the last times, you can send me an email, you can send an email to Alex if you have questions. We will communicate those with them, so don't worry about that. More information you also can see on our websites. And of course, again, you can ask me, you can ask your suppliers, no problem. So this was the getting started. I don't know if there are questions now, or maybe if we have some more time, I can show you some activities. So
no, I think you can go ahead with the activities, and we'll save the questions to the end.
Perfect. So I will now do the stop share. Do this. Sorry, I go here. I'm almost there. So yes. So do you see my screen?
No.
Okay, no problem. Then I do it. Where is it? There. Share.
Yeah, that's it.
There's it. Okay, now we are continuing with some activities. Some I will show you, and what I will show you is what do we do with activities, and what are the different parts of activities. And first of all, I need to show you that there are two types of programs. Number one, everybody who is doing the MyEmbrace treatment can use the trainer activities workbook. So it means that if there is a treatment, you will get the activities workbook. You give them to the parents and the patient. They have to fill in what they're doing every day, and every day when they visit you, or every month when they visit you in the clinic, you can check them and see what is happening. Then we have in our program different levels. So it means we have the general MyEmbrace user, and then the next step is the MyEmbrace member. And one of the things of the MyEmbrace member is that the membership is that they have access to the MyEmbrace activities application. So it means that in the App Store or in the Google Play Store, there is an app, and if you are a member and you download it, you will get, as a doctor, you will get login, and you can share it with the patients so they can do the activities in an application. The next step is the MyEmbrace certified provider. It means that they also will have access to the app, but there will be also access to all the artwork, and there will also be access to a 3D floor plan, what we will make together with you. We will support you in those situations. So first of all, the MyEmbrace membership. I will keep it short in this. If you want to be a MyEmbrace membership, there is a price. It's a it will cost you one time €2,500. Okay, and for that fee, you will get staff training. You will be on the MyEmbrace website. You will get a free course, etc. But the most important thing, what I would like to discuss now, is the MyEmbrace Activities app. So the MyEmbrace Activities app is a real application available in different languages. I'm not sure if it's in Romanian yet, but let's say no. So they can download it in several languages, and it supports you in the activities. And also everything what the patient is doing is recorded in this application. So what is happening now, I will show you some videos. So in this case, it's in the application there are two chapters. In this case, it's the introduction video, and there will also be a food and healthy diet video, what will explain what we expect from you as a patient. Those chapters are always open. Later on, I will tell you what I mean with open and closed.
Hi there. My name is Andrea.
And I'm Ben.
And today we're going to learn about some fun ways to help you get straight teeth and grow your jaws.
These are simple, fun exercises called myobrace activities. And to make sure you get the most out of the myobrace your doctor has recommended, you should do them every day.
Today we're going to explain how completing these activities every day, as well as wearing your myobrace, will help your teeth and jaws develop the way they should.
This is an example of the look and feel of the application. And yes, it's an animation. And yes, maybe some people say it's childish. But remember, the target group is the group 6 to 9. This is their world. They live in this kind of animations. They live in this kind of situation. So it is created for that target group. And yes, of course, there are also children age group 10 to 15. They think, yes, it's childish. Okay, that's what they think of everything. So don't worry about that. And I have the experience, so I know. And sometimes also adults use this, and then yes, okay, but they understand why they have to do it, and they accept it. So it's all in an animated surrounding. So then the next step is the nutrition. So like I told you, the introduction and the nutrition is always open. So children can always look in these chapters. They can always do the answer the questions. They can always are free to look in these kind of paragraphs. I will not show you everything about this. So what you see now is this is the start of the application. So you see 7 different chapters. The first one, the introduction, and the last one, nutrition. So actually it's 6. Introduction and nutrition are always open. Then you have the breathing, the tongue, the swallowing, and the lips and cheeks exercises. If they click and they open it, they see you have the light breathing, you have the paces, and the nose clearing exercises. I will now show you the difference between the explanation in the application, but also when it is done in a live situation in a clinic. So I will show you the paces. This is how it explains.
Now you have practiced how to breathe correctly using your tummy muscles. It's time to learn how to control your breathing. Remember, body posture is also very important for your overall health and development. When you are practicing your paces activity, make sure to keep it straight as possible. Your shoulders back and head up. The paces activity helps you develop better breathing control and make it easier to breathe through your nose. Start the activity with your myobrace in your mouth. Then put your finger over your lips to help you remember to keep them closed. Now breathe in gently through your nose, then out. On the out breath, keep your nose together, hold your breath, and begin walking while you count how many steps you can take until you need another breath. You should not feel puffed out during this exercise, so when you take your next breath, put your finger back on your lips to keep them together, and make sure to breathe gently through your nose. If you practice this exercise regularly, the number of paces you can do with each breath will quickly increase. Make sure to keep a record of how many paces you do. Remember, to reach those goals we talked about before, you will need to practice your myobrace activities every day.
So this is the explanation how it's done in the application. So every time before they start with the practice, with the activity, it's explained how to do it, what to do it. And when the patient is in a clinic, you can also, the assistant can also explain it to the patient. This is what you need to do, and how does it look like? Because now I will show you how it's working in a clinic. So this is a live.
This exercise is designed to unblock noses. Holding your breath leads to a buildup of carbon dioxide in the blood, which means more oxygen exchange with the body's cells. Normal oxygen exchange with the cells results in proper dilation of the body's tubes, including blood vessels and airways. Encourage the patient to record their paces on a paces record sheet to monitor their progress.
Paces is an activity that helps us have better breathing control through our nose. So to start this activity, I'll get you to pop your Maya brace in. Good. I'm going to get you to put your fingers over your lips to help us remember to keep our lips closed through this activity. We're going to have a gentle breath in and out of our nose. On the out breath, we're going to pinch our nose and we're going to count how many paces or how many steps we can take until we feel a slight shortage of air. When you feel that you need to have a breath, I want you to stop, take your fingers from your nose and back on your lips, and remember to have some nice gentle breaths in and out of your nose. So Taylor, when you're ready, I want you to have a gentle breath in, and on the out breath, I want you to pinch your nose and start counting your paces. So remember when you're finished, lips together and breathing through your nose. So we want to make sure that our breathing has returned back to normal before we go for another round. So this should usually take between 30 and 60 seconds.
So this explains very well that one of the staff members can perfectly explain this to a patient. And with all due respect, I don't think a doctor should do his time explaining this kind of activities. This is perfect for an assistant or for a staff member or a MyoBrace educator or training educator. So there are different situations. So this is the way how it's working. Then the patient starts with these kind of activities, and again, everything is based on using the application. So in the first thing, in the first step, it's explained what does the patient needs to do. So after watching the video, it's also on paper. It's explaining what the patient needs to do. And then, okay, are you ready to practice? Yes, I'm ready. And then it starts. Step by step, everything is controlled. And then how many paces did you walk? You have to say like this, okay? And then it is recorded. One of the good things from one of the good tools in the application is that there is a back-end program. And the back-end program will give access to the doctor, access to the assistant, and they can see what the patient has been doing, how much he has been doing, in how many attempts, etc., etc., etc. So in this case, in the back-end program of this application, the doctor can follow the patient. So what was the last activity? What were the last logs of the paces, etc., etc., etc. And if you as a doctor are satisfied with the results of the patient, you can open the next exercise. So you as a doctor, you decide what kind of exercises the patient will do next. And of course, everything is in a sequence, but if you are not satisfied, you cannot open, or you will not open the next exercise for the patient. So you are in control. So there are all kind of graphics what you can see, and it means that as a doctor you will get a doctor's login, so you can check in, and if you are in the backend program you can create new patients. So it means every patient who is doing this treatment, and you will give them access to the application. You will make all the important details. Give them a username, give them a login code, and you give it to the patient. There's also an option to make a practice account. The practice account is the account what you will use in your clinic. So don't give a practice account to a patient. The practice account will collect all kind of data, can be a mess. It's just to show what you expect from your patient. So all the patients are in here, and from this screen you can check what the patient is doing. So the light breathing awareness is open, and from this screen you can say, I'm now satisfied with this patient. He is doing the light breathing awareness very well. He did the quiz very well. So I'm now opening, in his next visit, I will tell him I open the PACES exercise, because that's the next step, what he needs to do. So, and again, you as a doctor are in control in what kind of activities you are doing or the patient is doing. Like I told you, the program also shows you what kind of activity was as latest, what kind of paces were logged, so what kind of logs were there. So you can follow what the patient is doing. You are in control, you are in charge. So in this case, you can see that this patient was doing the quiz of the light breathing awareness, and in 3 times he did the quiz 3 times with a score of 4. So it were 4 questions, and it took him 3 times to answer all the 4 questions. And it can for you also a piece of control or a way of controlling the patient, that he understands what he is doing. So all kind of graphics, so you see what the results are, how many paces in combination with seconds. So you can show, and this is a nice way of talking to the patient. And if the patient is telling, yes, I'm doing my activities all the day, all the time, and you are showing his logs and you're showing his data in the application or in the backend program, which I know you're not, because I see it. So what are we going to do about it? So besides the breathing exercises, we also have some tongue exercises. So I will show you now one, and that's the tongue clicks.
Tongue clicks. Did you know that for its size, your tongue has some of the strongest muscles in your body? Just like all your other muscles, though, they need to be exercised, or they can become weak. If you have weak tongue muscles, it will make it harder for you to rest your tongue comfortably in the roof of your mouth on the spot. The tongue clicks activity will help strengthen your tongue muscles. As well as making your tongue stronger, it's a good exercise to help you keep your tongue in the correct resting position. The first thing to do is position the tip of your tongue on the spot. Then, check in the mirror to make sure your whole tongue is touching flat against the roof of your mouth and suction there. Now click your tongue as hard and as loud as you can against the roof of your mouth. Do 30 really hard tongue clicks in a row, and pay attention to how your tongue feels. See how many clicks you can do in a row, because the more you can do, the stronger your tongue will become. Make sure to keep going until your tongue becomes tired. A fun thing you might like to try is clicking through the alphabet.
So those were some tongue activities. Then we have the swallowing, and I also will show you one of this. So that's the correct swallow.
Correct swallow. To begin, make sure the tip of your tongue is on the spot. You will need to make sure it stays there while you swallow. To start the swallow, close your lips together gently and flatten your tongue to the roof of your mouth without touching it to your front teeth. Now swallow with the even front to back full of the tongue. Your back teeth should touch together lightly when you do this. Make sure to practice this activity in front of the mirror so you can watch that there is no movement of your lips, cheeks, and chin muscles while swallowing. Also, keep an eye on your posture to make sure your back is straight, shoulders back, and head is held up. You should try to make sure you swallow like this every time.
And then as last, the chapters related to lips and cheeks, and it's the lip pops.
Lip pops. The lip pops activity is another exercise that will help your lip muscles to become stronger. It will also make it easier for you to rest them together comfortably whenever you're not eating or sleeping, which is your 4th goal. Remember, body posture is also very important for your overall health and development. When you're practicing your exercises, make sure to keep as straight as possible Your shoulders and head back. When sitting in a chair or standing, your feet should be flat on the floor. To do the lip pop activity, roll your lips into your mouth and squeeze them tightly together so you can't see them when looking in the mirror. Now pop your lips as hard and as loudly as you can. You should aim to do at least 20 or 30 pops, then keep going until your lips are tired. Keep a record of how many lip pops you can do.
So it's a good way in how to explain the activities, how to do the activities, and it's, like I said, in the current world of the children, it's all about applications, it's all about animation, it's all about living in a virtual world. So this is a good way of doing the activities. So there's, like I told you last time, there's the activity schedule. So you have all the appliances, what you want to use in this treatment. And in the first 3 months, you do the breathing exercises. Then in the next, you do the tongue exercises, the swallowing exercises, and the lips exercise. So this is the sequence, and this is the way they need to do it. And all the exercises are connected or are related to the application. So you see 17 different exercises, and it's all related to what's happening in the app or in the trainer book. Then I shortly want to show you something about the certified provider, because like I told you, the application is also for the people in the certified provider program. It's an additional €2,500. The floor plan, we will support you in the artwork, in the practice layout, and all kind of other different situations which you will have more. So you also will have a plate which you can hang on the wall on the outside, etc. I will show you what do you need. So you need an activities room, you need a records room, waiting area, consult area, and a treatment room. And we have all kind of different themes, different topics what you can use in your clinic. And we will help you with making the 3D floor plan. So together with you, together with our dealer, we will make the floor plan, and we will support you in what will be the best situation. So in Europe, we have in all the countries and in Africa, we have all kind of members and MCP. So I will show you some examples. So for example, this is one in the Netherlands. So you see the setup, how they have done it, and it doesn't mean you need a 200 square meter room. It can also be in other locations, and later on I will show you some in France who did it in a small kitchen. This is also one in the Netherlands. He is working with a speech therapist, so they have a whole setup in the city theme. This is the one in Germany. They have a pirate theme, and they make combinations between city, pirates, and farm. So they have all kind of different, the look and feel. Another one in Germany. I told you about the kitchen in France. So in the top two pictures, you see the room. It's not a big room. Below you see everything what is needed for this space. So it's all in the local language, and this is the result. So it doesn't have to be a big 200 square meter space. Be creative, and everything is possible. So this is a clinic that they are building, that we started with before the whole situation in the world started, and it will be finished probably afterwards. This is one in Poland. She was very creative. So you see the tree, and she didn't want to have the tree what we have in the artwork program. So she said, I go to the IKEA and buy a tree myself. And that's what she did. And this is her situation. So a lot of things are possible. Bulgaria, Kiev, I showed you this one. So a lot of things are there. I showed you already how to get results, why there are no results. So with this, again, I explained to you in the last 3-4 weeks, what's the introduction of in the myofunctional treatment, what's the philosophy. The last time I spoke about the product portfolio in MyoBrace and Myosa. Now we spoke about how to get started and the activities and what is behind the activities. What I would suggest is that I will send a WeTransfer link to Alex with a summary of all the information I have discussed. It's called the doctor's package. There is also the 10-slide consultation is in there. So there is research in there. So everything what we have discussed is there in a summary. I will send the WeTransfer link to Alex, and he will distribute it to the people who signed up. So for now, if there are questions, please let me know. I'm willing here to answer the questions, and if it's related to all the webinars, please let me know.
Okay, perfect. So the first question is if it is possible for a patient if he doesn't have mouth breathing, and if no, can we skip the first stage of the treatment?
No.
The doctor is probably asking if she can start with the T2 or K2 directly.
No. Always start. The sequence is always 1, 2, 3. So always start with phase 1, and maybe it's a short one, but always start with phase 1. Phase 1, phase 2, phase 3. So don't play with the protocol. Don't play with sequences. Just follow the protocol. Phase 1, phase 2, phase 3. And yes, sometimes it happens that after 1 month or 2 months, nasal breathing is already established in a good way. You can also see that the K1 or the phase 1 in this case can be there to get used to create the compliance. So don't stop, don't skip an appliance.
Yes, I can also confirm that because most of the doctors that come to us with broken appliances say that they started directly with the second one.
Yes, so you need to create compliance, and if there is already nasal breathing or partly nasal breathing, it's never wrong to start with the first one to get the compliance, to get the use of an appliance, because it will get more difficult in phase 2 and phase 3, or stage 2 and stage 3, because the appliance is getting harder. It's also in material, so it's difficult. So let them get used with the first stage.
Okay, good. Someone else is asking how many staff members can we bring to an in-office course?
In office, it is meant...
Probably in Netherlands.
I'm sitting here now, so let me tell. 1, 2, 3, 4. 1, 2, 3, 4. So it's 16. It's 32. There's space for 32 people here.
Okay.
So, and if necessary, we can create more. So it depends. Please discuss it with us, discuss it with Alex, and then we can see what we can organize. So everything is possible.
Okay. What are the languages that the app is available in? Because I know for sure in Romanian it's not.
No, and with no offense, and please don't be offended. The thing is, the application, the languages in the application are mostly done from Australia. So Australia is leading everything what has to be done with the websites, but also with the application. And to be honest, and it's not only Romanian, but also Estonian, Slovenian, Croatian, those kind of languages are too small for Australia. It's too far. The countries are too small. They don't care. And again, no offense. So it's available in English, it's Russian, French, Dutch, German, Spanish. And at this moment, they're also, I think, finalizing Italian. So those are the 7 or 8 languages. And Portuguese because of the Brazilian market. So those are the languages. All the other languages probably will not come.
Okay, so the app is done directly in Australia in all the languages. They're not done by the distributors or something.
No, the everything what the app is created with in our Australian head office. So all the languages are also decided in Australia, and what they choose is the world language, so English, Spanish, French, German, those kind of languages, Russian, and all the other languages are too small to invest in this kind of application. So they will also not come, I think, at this moment.
Okay. Someone else is asking if they can get the app without becoming a MRC member.
At this moment, no. Maybe in the far future, but at this moment the application is only connected to a membership.
Okay. We have a question about the summit in 2020, but like you said, you don't know this information for now, so it remains to be seen.
Yes, at this moment the summit is planned for the week, let me guess, 6 to 11 November, that area. And I know at this moment they're discussing if they will postpone it to next year. Because next year it will be for sure. For this year, they're still talking about it, and I know they are discussing it. So I think within 1 or 2 weeks, we know everything.
Okay. And we have some questions about the protocol flowchart, but we will answer those privately, like I said. Okay, thank you, Hans, again for these 3 wonderful webinars. I think you have walked us through all the myofunctional therapy introduction by now.
I hope. Thank you.
Like I said, maybe also we can do this in the future as new information arrives. Maybe we can also provide this information to the doctors that are interested in the myofunctional therapy.
I think it's a good way. It's a new way of doing a first step in the education, and later on we can organize the 1-day lectures or the 2-day lectures. But this is a good way of communication. I'm happy that there's a lot of response, that there's a lot of people who are willing to get to know more about this topic, because we really think it's an important topic, and it's really a health issue. It's a health situation. So I hope that everybody is convinced to start in some sort of way, so that we can make everybody more happy and more healthy. So yes, I agree with you. It's a good way. And again, thank you for giving me this opportunity together with you, of course. Yes, and for now, stay healthy and be safe and be happy tomorrow. That's what I would like to say.
Thank you very much. We will definitely will be.
Yes.
We would also like to thank our participants, because they showed great interest during these 3 sessions with you.
Thank you.
Now, after this 3 days, 3 hours, actually learning about myofunctional therapy, they have the basis to start something new, very good for their patients. So thank you once again to all the participants, and thank you, Hans, for your effort of being every time very punctual with us.
No problem. You know,
information that you have provided. Thank you very much.
I will send you the WeTransfer link with the doctor's package, so you can distribute to the people who want to have it.
Absolutely.
So I will send it probably tonight, and then tomorrow it can be distributed. But again, I understood that tomorrow there are other important things, so enjoy that first.
Okay. Thank you very much.
Thank you very much, and have a wonderful day. Bye.
Bye. Thank you. Bye-bye.